All right, welcome everyone to Radio Free New York. I'm Kevin Wilson, your host for the day. Appreciate you all being here, and I am joined by a guest for today. I am joined by Sean Hannon, our friend from Syracuse, and we're here to talk today about whether or not health officials are calling for an end to lockdowns. And Sean, you've been doing some interesting research on this, so we're going to bring you on to talk about that. So Sean, first of all, how's it going?
It is going, Mr. Wilson. Thank you for having me again.
Yeah, absolutely. So, of course, Sean again is our libertarian friend from Syracuse, and you have been discussing with experts the Great Barrington Declaration. Sean, what on earth is that? What does it have to do with this topic?
So the Great Barrington Declaration is a declaration that was crafted by three eminent epidemiologists. They were, collaborated in Great Barrington, Massachusetts, which is the home of the American Institute for Economic Research. I interviewed Phil Magnus, who is a senior research fellow with the American Institute for Economic Research yesterday. We're going to post that whole full interview on Monday, so you guys can tune in then for the whole interview. I think we got a couple clips we're going to play for you today.
Yeah, and where can they find that?
He breaks down the effectiveness of the lockdowns and talks about this Great Barrington Declaration and how it came to be. It's basically a growing movement where now there's over 500,000 signatures, almost 10,000 medical scientists. Let's say we got 26,000 medical practitioners. So again, it's only been out for a week, and it's very, very popular.
Yeah. So I mean, this seems to be building some steam, and we're seeing health officials want to end lockdowns. But why would they want to do that? Because we've talked about for so many months. Health officials saying that we need to do whatever we can to stop this virus, to save lives, to make sure that people aren't dying from COVID-19. So why would some health professionals be making the opposite argument?
Well, I think some of this started from 7 months ago when we were just being introduced to this virus. The lockdown seemed to be a measure to minimize the damage in hospitals, right? So let's not overrun the hospitals. Let's not overrun our system. Let's slow it down. And when we slow it down, we can then address the situation at a more reasonable rate, as opposed to having an influx of people. The lockdowns are now 7 months old, and the damage from the lockdowns is starting to outweigh the damage from the virus itself. Outside of the Great Barrington Declaration, even the WHO has come out and at least the British envoy has basically said, the World Health Organization does not advocate for lockdowns as a primary means of control of the virus. It's meant to be a pause for the virus to allow us to, reassess, reorganize, regroup, and get our resources in order so that we can address the situation better. We're 7 months into this. The lockdowns, and what the question maybe we can get right into Mr. Magnus, we asked him, what are the effectiveness of the lockdowns? His answer was pretty stark, I guess. So I don't know if you guys want to play that clip now.
Yeah, let's play that clip.
I have seen no evidence that the lockdowns have a meaningful effect on mitigating the disease, period. There are measures of the stringency or the severity of lockdowns that have been put in place. Oxford University's School of Government published one for all 50 states, as well as every country that has data in the world. And what it does is it measures on a scale of 0 to 100 how heavily locked down that society is. So 100 would be like a complete Wuhan-style or New Zealand-style lockdown during the peak of the pandemic. Most of the United States during the worst months of March and April hovered around 70 to 75 out of 100, and that's comparable to where Europe stood. It's comparable to where most developed industrial democracies stood. So pretty heavily locked down. What do we know from that? Well, if you compare that data to the actual case numbers and especially the death numbers, there doesn't seem to be any correlation whatsoever between the two. There are states that were under nearly complete lockdown, such as New York. There are countries under nearly complete lockdown, such as the United Kingdom, that have some of the highest coronavirus death rates in the world. Then there are states that are completely open, like South Dakota, that have a very low stringency index score And yet, the death rates there have been manageable. I mean, every death is tragic from this thing, but at the same time, we see quite a bit of differences between different regions of the world. So this notion, this entire premise that lockdowns had some sort of effect to mitigate the disease, the virus, I think is scientifically bunk at this point.
And so he points out that the lockdowns have not had a impact on the death rate from COVID. So what are we doing with the lockdowns other than causing economic destruction? And that's kind of where this Great Barrington Declaration comes into play, because they're offering a different solution than lockdowns.
Right. And again, going back to what you're saying at the beginning of this segment, the initial push behind the lockdowns was because we didn't quite know everything about coronavirus, and it was to flatten the curve, right, as people kept saying, to make sure that hospitals don't get overwhelmed, because there was a concern about a high number of people getting sick all at once. That didn't happen. It was managed effectively in some areas, not so effectively in others. I guess one of the things I want to push back on that clip, and just for clarity's sake, is I'm not sure it's fair to compare South Dakota to New York City. I mean, do you think that's a fair comparison?
Well, so I'm guessing you're going to probably go into something in the effect of the population and the travel and that is true, but if you apply that to a global scale, it falls apart, because New York is not in the top 50 most populated density cities in the world, and clearly are still number one. So do I think that played a role? For sure. And do I think the vast expanse of South Dakota plays a role in mitigating in that? Sure. But the lockdowns still have an impact, and the ones who didn't are, you're still seeing the unemployment impact. And like I said, we've learned a lot more about the virus at this point too, that the death rate is not what we once thought it was. We know who it targets. We targets very old people. The average age of death in this is over 80. So what are we doing by locking down a bunch of healthy people, not letting kids play volleyball or whatever the current activity that's banned by the governor? What are we doing when the lockdowns are causing more economic destruction than the virus itself? And I think that's where we're at.
Yeah, right. It's about finding the balance, right? Like who actually needs to be protected, and what are the trade-offs for both health and economic well-being related to the lockdowns, right? Again, if kids aren't out getting exercise, I'm not out getting, my volleyball exercise either. It's very sad. But there's trade-offs with this. And I think even, economists who recognize the damage that a virus can cause by many people getting sick would say that having a lockdown indefinitely is not sustainable. Even if the goal is to save lives, you can't do that forever, and it doesn't make sense from any perspective to try to do that forever. Yet there are still people saying that, we are failing as a country because we are not continuing the lockdown, even in areas where there are very few infections, and the number of deaths that are coming from those are coming from vulnerable populations that we might be able to take targeted steps to protect.
Right. And I think that's the biggest takeaway, and we'll get into this as we kind of talk about the Great Barrington Declaration. That's what they bring out, is their focused protection. Target the people who are at risk.
Yeah, that's right. All right, so again, we're talking with Sean Hannon, friend from Syracuse, and we're discussing whether or not health officials want to end the lockdowns too. All right, so we'll be back here on Radio Free New York in just a few minutes. Talk to you soon.
Your business relies on computers and technology to operate. Slow, unreliable networks and servers can cause unplanned downtime and affect your bottom line. The experts at Simple Tech Innovations are here to help. Their preventative maintenance program ensures that your computers and network are kept up to date and monitored for any issues, keeping your business running smoothly. They also help clients achieve HIPAA, PCI, and New York State cybersecurity compliance to keep your network safe safe and secure. Whatever your business IT needs are, SimpleTech Innovation should be your first call. They've won the Best in Rochester 8 years in a row and have an A-plus Better Business Bureau rating. Call them today for a free consultation at 585-200-3182. That's 585-200-3182. SimpleTech Innovations.
Escape from the everyday to a getaway at Woodcliff Hotel and Spa. Woodcliff features elegantly appointed accommodations, creative cuisine, themed suites, full-service spa Elan, and is Rochester's best venue for outdoor wedding receptions overlooking the city skyline. Woodcliff Hotel and Spa, where the experience is extraordinary. Located in Fairport, call 585-381-4000 or visit woodcliffhotelspa.com.
A reminder from Abate Monroe County. American bikers aim toward education. Distracted driving is dangerous, so pull over and eat. Don't try to read your mail and newspaper, and stay off your cell phone. Make a mental note to be more alert, making it a habit to expect the unexpected. Remember to look twice. Save a life. Train yourself to watch for motorcycles which are harder to see. Join Abate, and your family will be protected with a free $4,000 accident policy. Ride safe. Ride free. Ride often. Abate. If you ride with us. Google Abate Monroe County.
Why do businesses choose to move their website from Wix and Squarespace to SimpleTech Innovations? Maybe it's their excellent customer service or attention to detail. Maybe it's their ability to give a truly customized solution. Or perhaps they just like the fact that SimpleTech is a local small business that builds great relationships with its clients. Whatever the reason may be, you can rest assured knowing that the local team at SimpleTech has your best interest in mind when building or updating your website. They're hands-on and love helping customers achieve their goals. But don't take my word for it. They've won the Best in Rochester 8 years in a row and have an A-plus Better Business Bureau rating. If your website doesn't match your dreams or isn't achieving your goals, give the professionals at SimpleTech Innovations a call today for a consultation at 585-200-3182. That's 585-200-3182. SimpleTech Innovations.
You're listening to Radio Free New York.
Welcome back to Radio Free New York. I'm Kevin Wilson, your host for today, joined by Sean Hannon. And we're talking today about the Great Barrington Declaration, what it is, and why health officials are starting to come out and say maybe the lockdowns have too many downsides. There are too many downsides to lockdowns, and we need to open up a bit. Sean, do you want to talk a little bit more about that? And then we have a good audio clip in a sec, too.
Yeah. So the Great Barrington Declaration is kind of the birth out of three eminent epidemiologists, one from Harvard, one from Oxford, and one from Stanford. Those are the three leading signers on the Declaration. They kind of got in a room in Great Barrington, Massachusetts, which is where the name of the Declaration comes from. They put out, they met, they had a couple interviews with some journalists, kind of put out their information so that everybody could kind of get it there. Again, this was organized by the American Institute for Economic Research, which is in Great Barrington, Massachusetts. It has taken off. Like I said, we talked about how it's up to 500,000 signers, almost 10,000 scientists. If you want me to read a short blurb from it, I will, and then we can get into the clip if you'd like.
Yeah, let's do that. What do you got?
I said, this is just kind of like a summation of their declaration near the end, but I'm going to read it too. Those who are not vulnerable should immediately be allowed to resume life as normal. Simple hygiene measures such as hand washing and staying home when sick should be practiced by everyone to reduce the herd immunity threshold. Schools and universities should be open for in-person teaching. Extracurricular activities such as sports should be resumed. Young, low-risk adults should work normally rather than from home. Restaurants and other businesses should open. Art, music, sports, and other cultural activities should resume. People who are more at risk may participate if they wish, while society as a whole enjoys the protection conferred upon the vulnerable by those who have built up herd immunity. And the herd immunity part has kind of gotten a lot of pushback because people are saying that it's just careless and that there's going to be millions of deaths upon this if we try to just pursue herd immunity. And there's been Sunita Gupta, who is one of the Oxford doctor, basically put out a whole pushback on herd immunity and basically has backed up her position. Mr. Magnus does a great job kind of outlining the reasons for the Great Barrington Declaration in the clip that we're going to play. He kind of outlines how they got here, what their thought process was, and where it came to.
Yeah, so let's go ahead and put that clip going, and then after that, I want to talk about the herd immunity thing and what that means, and what some questions people might be having about that. So let's play that clip.
And the three main epidemiologists that we're visiting drafted a short statement outlining the basis for like a policy vision, a way out of the lockdowns, an alternative to the lockdowns. And what they do is they call it focused protection. The idea is focused protection is instead of shutting down the general operations of society, telling everyone to shelter in place, ordering businesses to close, and then never reopening, that we should start to look into strategic moves, more focused strategies that say protect the nursing homes. And we intentionally leave it open-ended in the document. So give you an example. What if we paid nursing home workers to self-isolate on site in their facilities, to live on site in their facilities, so they don't introduce outside transmission into the population of the nursing home itself? They'll actually address that kind of a situation in a more focused policy that aims at protecting the nursing homes. This seems intuitive, but it's something we still haven't tried 7 months into the pandemic. In fact, we've done the exact opposite in many states, as Cuomo's policy showed in New York, as Massachusetts copied, as other places kind of erred really early on. So the idea here is that we strategically protect the vulnerable populations, and that can be very strategic measures focused on nursing homes. It could also be general public health guidance for elderly people or people with conditions that put them at high risk on maybe they should stay sheltering at home at a greater frequency than younger, less vulnerable people. School-age children, for example, have a very, very low risk of having serious effects if they get this disease. Every disease has a risk of dying, whether that's the common cold or influenza or COVID-19, but we do know now from the data that people in the adolescent groups, young people under 40 are at very, very low risk relative to the elderly. This is a disease where, the average age of death is above 80 years old. So we know from demographic issues that focused protection could fit the numbers that we see from society much more effectively than this blanket one-size-fits-all statement that actually has severe, under-recognized economic, health, and personal well-being effects across all of society. So the gist of it is that that kind of a statement could provide a guidance, not all the answers, but just a starting point for a scientific conversation of a way to do this differently.
Right, and so I think they're talking about trying to start a conversation that hadn't been had, right? So there was some people who were individually advocating out there against the lockdowns, but now they're getting all together. They've put this declaration out together, and again, they're trying to, push forward a conversation for a better way forward through the virus. Yeah,
and so the question I'd imagine some people are going to have, right? I'm just anticipating the objections to this. They're the people shouting at the radio right now. You might be saying, I don't know on this station if they're doing that, but on some station they could be. But the people who are saying, well, herd immunity might not be a good strategy because A, a lot of people will die in that process, and B, we're finding out about a lot of other health effects of COVID-19 from the survivors, from blood clots, strokes, lung capacity issues, and a handful of other like fatigue-based issues too. Is that worth the long-term health risk to the individuals who become infected to pursue a herd immunity strategy?
Well, Dr. Sanucha Gupta says that there is nothing around coronavirus that should keep us from reaching a natural herd immunity. She had an article that she recently published, and I'm going to read from her. It says, in a nutshell, the development of immunity through natural infection is a common feature of many pathogens. It is reasonable to assume that COVID-19 does not have any tricks up its sleeve to prevent this from happening. It would pose a very serious problem for the development of a vaccine if it did. So we're trying to develop a vaccine in the same vein of trying to develop a natural immunity to this virus, if there is this underlying peculiarities like there is like with what's the I can't remember now. There's certain diseases who have variables who don't make it difficult to develop herd immunity. There's nothing in the COVID research that makes it think that is going to be.
Yeah, so I guess that's a point. I think what people would say is like, well, why not wait till the vaccine comes out, right? Like, let's just keep these lockdowns going a bit longer. What's the downside of that?
Well, I mean, your continued economic destruction while you're in lockdown. The lockdowns have shown not to stop the spread of the virus, so they're not really doing anything. They're just basically causing economic destruction. If you're trying to figure out a way to reach a level of immunity, or try to stay locked down until we have a vaccine, I think you're going to be waiting another 6 to 8 months minimum. We can't last that long.
Yeah, you're right. Like 6 to 8 months, if we're lucky. They're trying to fast track some of these vaccines, but like realistically, it's a tough virus. There's a reason why there's not like vaccines for like the common cold, which is like a related virus. It's not to say this isn't dangerous, but it's related. And I'm not going to try to explain all that right now, but it's tough to do.
Right.
And particularly with a virus that's
common cold by now, we would have.
Yeah, right. And so developing a vaccine that provides immunity for a significant amount of time and allows for changes in evolution of the virus is very tough. So that might not be happening. We might just have to find better ways to live with this virus being around. And we've done that with past serious strains of the flu in the past too. Like the flu that goes around every year is kind of a distant cousin of a flu that impacted the United States, I think, in the 50s and 60s. And initially, it had killed a lot of people. It got a lot of people very sick, but eventually the virus kind of mellowed out a little bit, and there started to be different pockets of immunity that stopped that flu from spreading as quickly and being as serious, and people developed more effective treatments when the illness did strike.
Yeah, and this virus seems to have become more contagious and less deadly along the way. So the death rate is plummeting everywhere, and we're getting more positive cases. I don't want to know if you want to get into the PCR testing and whether or not that's an accurate means of actual getting a positive test or not. But we have these positive tests, but they don't correlate with the deaths, and that this seems to have been a long enough trend to now know that the death rate is not what we once thought it was.
Yeah, and you mentioned that the PCR test. So what are the issues with those? We got a couple minutes to do that.
Yeah, so the PCR test, I don't know if I have a couple minutes here, but this is a diagnostic test that allows to get your positive test. It's what they use when they send your sample out. What it is they send the sample around in a centrifuge, I believe, and they're sending fluorescent light, I believe, to try to find the RNA of the virus. So they're looking for the virus through this technique, and as the virus spins around, they zoom in to try to find the virus. And if they don't find it, each cycle goes around, they zoom in one additional, closer to this virus. If it takes 20 to 27 cycles to reach the virus, you're probably contagious. You probably could be infectious. We test to 40. It's
right.
Mind-boggling.
So well beyond
the recommended threshold.
Well, good to know. All right. Thanks again. We're joined by Sean Hannon. We're talking about the Great Barrington Declaration and the lockdowns. We'll be back here on Radio Free New York in just a few minutes.
God bless America.
WYSL.
AM 1040 Avon Rochester, FM 92.1 Rochester, and FM 95.5 Spencerport.
Here's the latest forecast from the News 10 NBC Weather Center. Tonight, showers likely, a little breezy and turning much cooler. Will drop into the low to mid 40s. Friday, morning clouds, couple of showers will slowly clear for a bit of sun in the afternoon. A much cooler day, high in the low 50s. Partly sunny Saturday in the 50s. I'm Rich Cornelia, WYSL.
Why do businesses choose to move their website from Wix and Squarespace to SimpleTech Innovations? Maybe it's their excellent customer service or attention to detail. Maybe it's their ability to give a truly customized solution. Or perhaps they just like the fact that SimpleTech is a local small business that builds great relationships with its clients. Whatever the reason may be, you can rest assured knowing that the local team at SimpleTech has your best interest in mind when building or updating your website. They're hands-on and love helping customers achieve their goals. But don't take my word for it. They've won the best in Rochester 8 years in a row and have an A+ Better Business Bureau rating. If your website doesn't match your dreams or isn't achieving your goals, give the professionals at SimpleTech Innovations a call today for a consultation at 585-200-3182. That's 585-200-3182. SimpleTech Innovations.
At Victor Chrysler Dodge Jeep Ram Anthony Drive off Route 96 in Victor, they're celebrating Jeep's 80th anniversary with Adventure Day savings. For a limited time, lease a 21 Jeep Gladiator Sport 4x4, $279 a month for 42 months. A 2020 Jeep Grand Cherokee Laredo 4x4 is just $299 a month for 42 months. Lease a 2020 Jeep Renegade 4x4, only $189 a month for 36 months. Or a Jeep 2020 Compass Latitude 4x4 is $249 a month for 36 months. Jeep, America's iconic four-wheel drive brand, and Victor's got a great selection. Shopping for a pickup? Victor's got lease deals on the Motor Trend Truck of the Year, Ram. Lease a 2020 Ram 1500 Classic Warlock 4x4 for just $199 a month for 36 months. Be sure to get full details from the dealer. Equipment and MSRP vary by model. We're here to fully serve Chrysler, Dodge, Jeep, and Ram customers in Victor, Canandaigua, Macedon, Fairport, and throughout the Metro and Finger Lakes. Shop with confidence and safety and full CDC compliance. Victor Chrysler Dodge Jeep Ram, 6560 Anthony Drive in Victor.
There's a place in the village of Avon you and your critters will love. Whether they're big or small, whether they've got hair, fur, or feathers, Avon Feed fits every need. There's a full selection of pet foods for dogs and cats, bird feeders, suet, and dry shot boots and garden shoes. They've got grass and clover seed too. Check out our frequent flyer birdseed program. Buy 10 bags of birdseed, get the next bag free. Choose farm feeds and great equine products like Blue Seal and Neutrina, plus Poland drains. Everything for your pet, from feeding bowls to toys, leads, collars, and tie-outs. Avon Feed and Supply has what the big pet chain stores will never have. Tim Cole and his great knowledgeable staff. And if you think you'll save money at that pet superstore, well, think again. While you're at Avon Feed, don't forget the two-legged pets with River Rat Thousand Island cheese and great flavors, including hard-to-find mean and nasty, plus Once Again nut butters, Nunday mustards, Dan's garlic, and Rickles pickles. Open weekdays 9 to 6, Saturday 9 to 4. Avon Feed and Supply, West Main Street at the bottom of the hill, just west of the Circle.
The historic family furniture building has been totally remodeled. The savings are historic too. Get $50 off purchases of $4.99, $100 off $9.99, and $350 off $34.99. Amazing discounts on Restonic Biltmore sleep sets. Add an adjustable base to any queen mattress for just $3.99. Shop sofas, recliners, dining furniture, and flooring. 0% financing for qualified purchasers. The grand reopening sale at Family Furniture in downtown Perry. Open Monday, Tuesday, Wednesday, and Friday 9 to 5:30. Thursday 9 to 7. Saturday 9 to 4.
Hi, I'm Dr. Pat Brophy from UR Medicine, Golisano Children's Hospital. When your favorite team wins, it's because they work together. When a medical team saves a life, it's because they put all their skills together. That's why Golisano Children's Hospital is so dedicated to creating a healthy community. It will give kids in the region access to advanced care, help us do groundbreaking research, and provide top-notch training to the next generation of pediatricians. You can help us do this, so please give to Golisano Children's Hospital.
You're listening to Radio Free New York.
All right, welcome back to Radio Free New York. I'm Kevin Wilson, your host for today, and quick shout out down the line too. Not only are we on WYSL from noon to 1 live on Thursday, you might be hearing a rebroadcast over the weekend too, but if you're listening now on WYSL, give us a call. 585-346-3000 if you want to participate in the conversation. Of course, you can participate online too on our YouTube channel, on our Facebook pages, however you're listening to Radio Free New York. Leave us a comment. We'll discuss those if we can. And again, give us a call, 585-346-3000 if you want to participate in this conversation. But shout out to our friends over at WACK out in Newark and our friends down in the Southern Tier, our friends at WENY, The Patriot, Elmira. So thank you all for listening for this show. Thank you for being a part of the Radio Free New York audience. But again, we're here with Sean Hannon, and we're talking about lockdown policies. And you're talking about the PCR tests that are going on right now, and how they're made to be so sensitive that they trigger positive results, even if someone isn't necessarily contagious.
Correct.
And so could someone become contagious though? Is that why they do it? Like I honestly don't know a ton about this stuff, but I know you've done a lot of research on it.
Yeah, so they tell us they do it out of an abundance of caution, right? So they're trying to they want to make sure they're not missing any tests. The problem is we don't know where these samples are becoming positive. At what cycle threshold are they actually becoming positive? If they're in the 20 to 27 range, then we need to take action on those people. Those people should isolate. They should take precautions. They're more likely to be infectious and have symptoms. I think I mentioned before we went to break that we test a 40. There was a study out that came out in September that said cycle threshold at 35 creates 97.3% false positives. So 2.7% of positive tests at cycle threshold 35 are actual positive test, or 97% are not. So basically 97% false positives. We're testing to 40. So and those are like magnitudes of greater zooming as you cycle. It's not just 1 degree. There's like magnitude of 10 every 3 cycles. So it's kind of like a Richter scale in the sense that each time you zoom in, you're greatly magnifying this thing. So at 40, you're not sick. You're nothing. You don't have the virus. You have some artifact of the virus that's still floating around in your system that this test was set to find basically at a hypersensitive rate. So I wish we had a cycle threshold that would coincide with our positive tests so that we would know actually which of these positive tests are actually something we should address, if they're contagious, if these people need to self-isolate, and whether or not they're a threat to anybody else. We don't know that because they're testing at such a mind-bogglingly high threshold.
Yeah, no, I mean, if there isn't studies on this, I would hope that something like this comes out soon because, that's pertinent information.
The New York Times had an article August 29th saying all this, basically saying, hey, your positive test is probably not positive. We're still here 2 months later, still doing the same thing. So I don't know why that hasn't been addressed or changed, or at least let us know why there's confusion clearly out there, and I don't know why the people, they have to know that testing at 40 is not going to give you accurate results. It's just going to give you results. So I don't know what the method behind the madness is, but it's highly sensitive and giving us numbers that I don't think are that accurate.
Yeah, no, absolutely. So I want to pivot a little bit because we had started talking about some of the negative health outcomes of lockdowns themselves. So not merely the economic outcomes, which are worthwhile in their own right, but what about the health outcomes too? Like why are medical professionals lining up around this?
Well, right. So I mean, just the idea of so obtaining a cancer a screening. If you don't get one of those, you're more likely to get the cancer. There's all these daily things that people have been banned from doing or scared from doing that are setting themselves up for long-term health effects that are not, or they're probably going to be more deadly than the virus themselves, whether or not they get it or not. Like I said, we mentioned cancer screenings, but there's, these doctor visits. I mean, most of these places are not open like they were, and people are scared to go to these places and therefore not getting the treatment that they need, causing long-term effects that are going to be greater than the virus itself.
Right, yeah. So if you're afraid to go to a doctor, you think, well, why would I go to a place where there may be sick people? I could get infected, So you're taking that, maybe have an abundance of caution because of what you heard in the news and everything. And now, because of that, you're not getting the cancer screening, you're not getting the cholesterol screenings, you're not getting the blood screenings that you might need to. That might be early warning signs of greater health issues that are going to be much more serious later on.
Yeah, and these are going to directly affect the people that are the most vulnerable already. So the people with the least amount of resources to deal with this are the people who are going to suffer the most.
Yeah, and procrastinating on health stuff is, it's no joke, right? It's like, again, if you go and you get stuff early, it's not only better for your overall health, it's also, going to be less expensive often by getting treatment early. So, it's incredibly important to go out and do this stuff. And now, so like at least in New York State, it is easier to get to a doctor now, but for a while it was state policy, essentially, all quote unquote elective surgeries were canceled, which, harms the quality of life for many people. And we had talked about that with a previous guest. If you can't walk and you can't get a surgery, what does that mean for your overall health, your mental health? How does that impact you long term? And again, you're able to get to a doctor's office now, and luckily, and this is another thing related to that, is a bigger topic, but it's much easier to get telemedicine now. There's some still remaining government barriers and just kind of cultural barriers to embracing telemedicine that have finally started to go away. And I think that's one of the few silver linings that I hope sticks around following this pandemic, is that you have greater access to healthcare because of telemedicine. But overall, these health professionals are concerned that on net, we're going to have worse health outcomes if we have government policies that make it difficult to go in and get checkups.
Yeah, right. Now, I'm just looking at a study here from the Veterans Administration. They found even a 1-month delay in obtaining treatment for cancer increased mortality rate by 20%. So we're 7 months into this. If you've been putting something off or don't even know and missing your checkups, there's a chance that you have something that you're unaware of that's going to be way more deadly than the coronavirus.
Wow. No, that's a huge number. Yeah, and so let's say, so what are the solutions? And let's go into that a little bit more. Because I'm getting some comments from Josh. He was talking about how, like, in the southern tier of New York, people are worried about, like, the patients coming up from New York City. We talked about that, way back, in April, right? And he's saying, Cuomo said that the current policies are based on fear, not science. I don't know if that's an exact quote there, but
yeah, I think it was a little. I read that. I don't know that that's what he was meant there when he said that either, but.
Yeah, I mean, I don't really want to give Cuomo credit for much, because I think Governor Cuomo has his book coming out.
Oh, it's out.
Yeah, so that
he wrote a book at halftime.
Yeah, it blows my mind that the state with either the most or the second most COVID-19 deaths,
by far the most,
is doing a victory lap with their response. Like, how on earth does anyone look at this clown and think, yeah, no, that's the policy we want to follow? Look at the results. Look at what happened.
Yeah, no, there's a complete disconnect from what actually happened on the ground to the sentiment behind that governor. I mean, his approval rating is still way higher. It's down from what at its peaks, but it's still way higher than what his results should merit. So he leads the league in deaths. He leads the league in everything terrible about this disease, the lockdowns and the virus. He's handled it terribly. Obviously, we can talk about the nursing home order. That is clearly getting a lot of attraction. There was a rally there in Albany yesterday trying to increase some visitation rights for nursing homes. But the way that the nursing homes have been handled in this state has been absolutely atrocious. The Department of Health should be ashamed. The whole system is broken, and I'm not sure. I'm guessing this virus just kind of shed light on the problems that existed long before it was there.
Yeah, no, absolutely. It's brought a lot of these challenges to light, and I was at a rally the other day related to nursing home visitation rights, and I want to pick up that topic when we come back, and talk more about, like, what do we do? What are the big problems that we need to solve here, and how can we move forward, and how can you express your rights in this situation? So again, Thanks for listening to Radio Free New York. We're here with Sean Hannon, and we're going to be back in just a few minutes.
Why do businesses choose to move their website from Wix and Squarespace to Simple Tech Innovations? Maybe it's their excellent customer service or attention to detail. Maybe it's their ability to give a truly customized solution. Or perhaps they just like the fact that Simple Tech is a local small business that builds great relationships with its clients. Whatever the reason may be, you can rest assured knowing that the local team at Simple Tech has your best interest in mind when building or updating your website. They're hands-on and love helping customers achieve their goals. But don't take my word for it. They've won the best in Rochester 8 years in a row and have an A+ Better Business Bureau rating. If your website doesn't match your dreams or isn't achieving your goals, give the professionals at Simple Tech Innovations a call today for a consultation at 585-200-3182. That's 585-200-3182. Simple Tech Innovations.
If you're looking to market and grow your business, make new business connections, and give back to the community in a meaningful way, consider joining the Greece Regional Chamber of Commerce. We're the largest suburban chamber in Monroe County, and we offer networking, education, marketing, insurance, and advocacy. You do not need to live or work in Greece to join. Our members come from throughout the region. In short, we're better together, and together, we're moving business forward. Visit greecechamber.org or call 585-227-7272 to join today.
A reminder from Abate Monroe County. American bikers aim toward education. Distracted driving is dangerous, so pull over and eat. Don't try to read your mail and newspaper, and stay off your cell phone. Make a mental note to be more alert, making it a habit to expect the unexpected. Remember to look twice. Save a life. Train yourself to watch for motorcycles which are harder to see. Join Abate, and your family will be protected with a free $4,000 accident policy. Ride safe. Ride free. Ride often. Abate. If you ride with us. Google Abate Monroe County.
Your business relies on computers and technology to operate. Slow, unreliable networks and servers can cause unplanned downtime and affect your bottom line. The experts at Simple Tech Innovations are here to help. Their preventative maintenance program ensures that your computers and network are kept up to date and monitored for any issues, keeping your business running smoothly. They also help clients achieve HIPAA, PCI, and New York State cybersecurity compliance to keep your network safe and secure. Whatever your business IT needs are, Simple Tech Innovations should be your first call. They've won the best in Rochester 8 years in a row and have an A+ Better Business Bureau rating. Call them today for a free consultation at 585-200-3182. That's 585-200-3182. Simple Tech Innovations.
Radio Free New York.
There it is. All right, welcome back to Radio Free New York. I'm Kevin Wilson, your host for today, joined again by Sean Hannon, for our friend from Syracuse, and we're talking about, why healthcare experts are talking about why it might be time to move on from the lockdowns, why that's not the best solution. I'm not going to dismiss all the concerns about coronavirus, but why lockdowns themselves might not be the best solution to this. And we talked briefly about the nursing home issue. And I do want to just share, I went to a rally last week related to the nursing home lockdowns and having kids go to school too. But some of the stories that people shared with me were just heartbreaking. People told me how, their parents were in some of these facilities and they had to go months without seeing them, not knowing if, February was the last time they were ever going to see their mother alive. And for some people, that was the case. People told me that, they were not able to see their parents, a mother or father, one more time before they passed because of the lockdowns. And even when you do have the opportunity to go in, and it's just barely started to open up for some facilities, even when you do have the opportunity to come in, you often have to take a COVID test, which can take a while to come back. You have to go in and you have to, wear like a mask and a face shield and all this stuff. And oftentimes they won't let you touch or interact with, your grandparents. So if you wanted to hold your parents' hand, if you wanted to give them a hug, if you wanted to give them some sort of, comfort, you're not able to do that. You sometimes with some facilities, what I've been told is they have a plexiglass barrier between you and your parent, and yeah, I can't imagine if one of my relatives were in one of these places and I weren't able to go and talk with them, to go and to just interact with them in any meaningful way, and having all these barriers between you, it's absolutely heartbreaking. And Sean and I were talking over the break about how New York State had messed up so much on the nursing home issue that they've kind of overcorrected. They're so worried that people are going to blame them for anything that happens, that they've now overcorrected and made it difficult for people to have meaningful interactions with people who are living in these facilities. And that isn't good for the mental health and the overall health of the people living there either. Sean, you want to add to that?
Well, I was going to say I had a very similar story that was just told to me a couple days ago by a friend who had reached out, know that I was talking about this, and basically was telling me that I was right, saying that he hadn't seen his mom since February. No visitations. They had a brief window where they reopened. You did need to have a negative COVID test to enter. The sister of my friend here did get in, and he did not have a test in time before they reshut the facility down, and has been shut ever since. So he hasn't seen his mom since February. He tells me that the only personal interaction he gets is basically when they put food at the door. So it seems like the worst possible scenario. It seems tragic. I don't even know how to put it into words, where these people, these humans, are basically being treated as furniture almost, and it's terrible. And I don't know how to break this cycle and how to get these people the care that they need.
Yeah, no, it's absolutely heartbreaking. It's awful. And I look at this and I hear these stories and I think, man, there has to be an effective way where we can keep people safe, but give them the meaningful human interaction that's essential for well-being.
Yeah.
The meaningful human interaction that everyone deserves. There's got to be a safe way to do that. It's got to be a safe way that you can get in and talk with people. And it's also like, it's interesting to see, like I know there's supposed to be a development of instant tests too, so I want to see if those can get in the facilities quicker. That'd be great if we get that. Right. And again, going in and just finding a safe way to give your mom a hug. My goodness.
Yeah, there has to be a way. And like I said, that's why I have encouraged by this Great Barrington Declaration, because it kind of focuses the attention to the elderly and the nursing homes specifically, where these facilities, that's where we are hit. That's where the attention needed to be, and we basically did the exact opposite of that, and we locked everybody else down and let the nursing homes burn. And that's kind of where we're at, and I do agree with you that they overcorrected, and now that this is a tight lockdown in large part to kind of save face from what they did at the beginning of this.
Yeah, that's terrible. So for our last couple minutes, let's discuss again, what are the solutions? They're calling for, reopening of schools. There's one I didn't like, going back to work. Sean, I like working from home. I'm happy with it. But I get that for some people that makes more sense to be in there. I do miss some of my coworkers interacting in person. But
yeah, well, I think they said should, so you don't have to. I mean, they're basically saying they're encouraging that interaction, right? So obviously, I know nobody really wants to go to work, and if you can work from home, that's great. The idea is, though, that if you're healthy and you can do it, you should probably do it just to maintain your mental health and, I don't know, your immune system, too. I mean, that helps you interacting with people.
Yeah, that is a good point, right? And that's you still gotta to build up that immunity to some of the other colds, and it'll be interesting to see over the next couple of years, because we have the technology to stay at home for a prolonged period of time. Is be cautioned, like how is that going to affect our overall health? Because there are in fact other things going on besides COVID-19 on the health perspective, like in terms of diseases too. Like flus, colds, other things like that. Is there going to be less herd immunity for those things because we're distancing from each other?
And this is only because you brought up the flu there. Maybe you think of a side note there, but so because we had mild flu seasons the last couple of years, we had a ripe, people that were ripe for this new disease because the flu did not take its normal toll through our population the last couple of years. We had this buildup of potential sick people who ran into this virus, and we are where we are.
Yeah, it's interesting, and something, I wouldn't really think about is, normally that would impact people in a different way. And I said, hopefully, this year my hope, I think all of our hope is, of course, that there's not any big upsurge in virus. There's murmurs of that happening in New York State right now, but we're sitting with a mostly open state, although not completely open state, in the areas that we've hit on. How does the virus surge, if at all, if people are going back to eating inside more often now, or going back to school more often, or...
And I assume there's going to be a surge in cases because that's what viruses do. They spread, and it's a question of whether or not the virus spread is actually going to overrun our system again or cause an increase in deaths. If those don't correlate with the rise in cases, I think we're just dealing with another virus that the humans have been dealing with, respiratory illnesses for our whole existence, and I think this is just the latest one.
Right, and that's the thing to keep in mind. Again, the purpose of the lockdown, if you were to advocate for one, is to stop the overrun of the hospitals, right? It's flatten the curve, right? But if the number of people who are going to require hospitalization and the number of people who are going to die because of the virus are a little bit lower than we thought, or that number has actually changed, then overreacting by shutting everything down at the first sign of a spike in virus cases is not the right solution.
Correct.
All right, so we only have a couple minutes left here, but so I want to give you some time to talk about where can people hear this full interview? Where can people hear more about you? Sean, tell us about it.
Yeah, so we have the Sports, Clicks, and Politics podcast. You can find us. We live stream the show every Monday at 12. You can find the full audio version at all your favorite podcast services, iTunes, Spotify, all the good ones, Stitcher, all those. But we do a live stream where you kind of get to watch us do the show on Monday from 12 to 1. And the full interview from Mr. Phil Magnus will be part of a Monday show.
Yeah, no, and it's definitely something I'm looking forward to. And that's Phil Magnus. He's from AIER. That's it.
The American Institute for Economic Research, correct.
Yeah, and so I've even listened to these couple of clips and seeing this stuff. I think this is incredibly important. It's going to be a huge policy issue following the election. How do we continue to respond to coronavirus, and how do we make sure that we respond in a way that isn't going to trash the economy, to make health outcomes worse, and erode our liberty too. I mean, there's value in that too. There's value in liberty in its own right.
That's right.
All right, so we are just about running out of time, but again, Sean Hannon, I want to thank you so much for being here today. I appreciate you doing the research and taking the opportunity to find interesting people to have these discussions and sharing it with us.
Thank you for having me, and remember, Epstein did not kill himself.
There you go. All right, thank you, Sean, for that reminder. All right, so we are out for Radio Free New York. Thanks again for joining us. I'll be back tomorrow.